Hey there, I'm back. It's Dr. Hart, and I have a couple of quick questions. This is just a pop quiz, pharmacology, psychopharmacology. Just 2 questions for now, and I'll have more soon, so look out for those. Subscribe to my YouTube channel, Nursing with Hart, PhD. So let's go. Look out for the ones that are coming up, okay? And let's start with these 2 questions for now. Question 1. A client was recently admitted to the inpatient unit after a suicide attempt. He has been placed on a tricyclic antidepressant. Which action should the nurse implement to maintain the client's safety when he is discharged? Okay, so you have to consider the clues in the stem of this question. He has a previous suicide attempt, which means he is at a higher risk for a future suicide attempt. Okay, so let's look at the answer choices. Letter A, provide a 6-month supply to ensure long-term compliance. B, provide a 1-week supply of medication with refills authorized only after he visits his provider. C, encourage him to increase fluid intake to counteract a common side effect of diarrhea. Or D, educate him not to eat foods that contain tyramine. Okay, so you have to know the concerns for tricyclic antidepressants. Okay, and another clue in the stem of this question is, what action should the nurse implement to maintain client safety when he is discharged? Okay, so he's being discharged on a TCA or a tricyclic antidepressant. All right, I'll give you a minute to think about this one, and we'll come back. Okay, we're back, and the correct answer is letter B. Provide a 1-week supply of medication with refills authorized only after he visits his provider. So I know if you're going to be an RN, you're obviously not going to be prescribing, only if you're a psych nurse practitioner. So if you're an RN, but if you see an order like this, that provides more of a 1-week supply, then you might question that, and that's where your critical thinking is going to help you. Okay, so provide a 1-week supply of medication with refills authorized only after he visits his provider. Okay, let's see why this is the correct answer. So the suicide risk often increases as the antidepressant medication takes effect and the client's level of depression and mood improve. The client may then have increased energy with which to implement a suicide plan. And I have talked about this in previous content lectures about suicide prevention and also depression disorders. If your client is depressed, if they are having suicidal thoughts, they may not have the energy to carry out the suicide plan. But once they start on an antidepressant and the mood lifts and they have more energy, they may have the energy to carry out the suicide plan. Okay, and so let's look at the other answer choices. A, provide a 6-month supply to ensure long-term compliance. That's too much of a supply. That's too much of a supply. There should only be a 1-week supply so that the patient has to come back and visit the provider to be reassessed. Okay, letter C, encourage him to increase fluid intake to counteract common side effects of diarrhea. Diarrhea is not a common side effect of a tricyclic antidepressant. And D, educate him not to eat foods that contain tyramine. That is not a side effect of tricyclic antidepressants. Educating your client on not eating foods that contain tyramine, that is a side effect of MAOIs or monoamine oxidase inhibitors. All right, let's go on to the second one. A client was recently admitted to an inpatient unit after a suicide attempt and is prescribed a selective serotonin reuptake inhibitor or SSRI. The nurse teaches the client about serotonin syndrome, which includes all of the following symptoms except, and I covered this in my psychopharmacology lecture about serotonin syndrome. You must know the signs and symptoms of serotonin syndrome. All right. Is it A, change in mental status, B, myoclonus, C, blood pressure lability, or D, priapism? The other clue in the stem of the question, this is why you have to read these questions at least a couple of times. It's asking you, the nurse teaches the client about serotonin syndrome, which includes all of the following except. So you got to pick out the one that is not a symptom of serotonin syndrome. And I'll give you a minute to come up with the answer and we'll come back. Okay, we're back, and the correct answer is letter D, priapism. Okay? So that is the only one that is not a symptom of serotonin syndrome. Okay? So change in mental status, myoclonus. Myoclonus is a sudden, brief, involuntary muscle jerks, twitches, or spasms. Blood pressure lability, that's like a blood pressure that can go up or down. So A, B, and C are symptoms of serotonin syndrome. So D is the one that is the exception. Okay, so that's it for now. I'm gonna put together a couple more, and I'll come back with another pop quiz for you on the psychopharmacology. All right, look out for it. Have a great day.